Welcome again to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. As always, we will continue to bring you the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to the 15th of May 2025. As always, our information is drawn from regional health ministries, institutions, advanced data and news outlets coupled with our internal data gathering platform HealthConnect Middle East. This week, the Middle East's healthcare sector demonstrated dynamic momentum, balancing policy-driven innovation with urgent public health demands. The defining theme was scaling innovation through partnerships, workforce localization, and digital platforms. Saudi Arabia, UAE, and Qatar stood out in pushing forward with hospital expansions and health tech acceleration, while Lebanon and Gaza faced deepening humanitarian and health crises. Critical attention also emerged on population health infrastructure and chronic disease prevention, as new models of care and cross-border public-private collaboration surfaced across the region. What new healthcare policy and government initiatives results this week? Saudi Arabia, Saudization and professional licensing expansion. Saudi Arabia's Ministry of Health and Ministry of Human Resources jointly announced additional steps in the kingdom's Saudization strategy for the healthcare sector, reinforcing compliance monitoring and introducing digital tools to track workforce ratios in hospitals and private clinics. As of May 12, local health clusters were issued quarterly performance targets linked to workforce nationalization rates. UAE, cross-border health governance. The UAE Ministry of Health, MOHAP, issued new health regulatory guidelines for foreign-trained clinicians, easing the recognition process for licensed professionals from Australia, the UK, and Canada, with the goal of filling shortages in specialty care and remote facilities. The regulation went into effect on May 9 and supports UAE's 2025 health coverage expansion plans. This week brought continued innovation in life sciences and research. Qatar research partnerships on chronic disease. Weill Cornell Medicine Qatar, WCMQ, launched a clinical research consortium on May 10 to investigate genomics-driven predictors of type 2 diabetes and metabolic syndrome in GCC populations. The project includes Qatar Biobank and Sidra Medicine, with long-term support from the Qatar Foundation. It aims to build an AI-integrated database of patient biospecimens and risk phenotypes for precision prevention in Arab populations. UAE Regenerative Medicine Trials. A UAE-based clinical research center, in collaboration with international partners, announced its plan on May 13 to begin Phase 1 trials of a stem cell therapy for spinal cord injury, making it the first regenerative trial in the Gulf of its kind. This follows earlier studies conducted in Canada and Japan, adapted for the regional demographic and trauma patterns. What did we see in biotech and pharmaceutical developments? Saudi Arabia Biomanufacturing Acceleration. Saudi Arabia's Public Investment Fund, PIF, initiated discussions with two major CDMOs, contract development and manufacturing organizations, to explore the localization of biologics production, particularly monoclonal antibodies for autoimmune and oncology indications. The plan, announced publicly on May 10, falls under Vision 2030's bioindustrial pillar and complements recent initiatives to incentivize contract R&D hubs in Riyadh and NEOM. Jordan Generic Drug Export Strategy. The Jordan Food and Drug Administration, JFDA, issued an export-oriented reform this week, simplifying quality control documentation for generic drug companies targeting Africa and South Asia. The policy, launched on May 8, is expected to increase Jordanian pharma exports by 20% over the next 12 months. Importantly, let's now talk about public health challenges and disease outbreaks. Gaza humanitarian collapse continues. As of May 13, UN agencies reported that over 1.1 million people in Gaza are in catastrophic hunger conditions. The collapse of cold chain systems has halted vaccine distribution, and diarrhea-related deaths among children under 5 have surged by 64% compared to April. UNICEF issued a Level 3 alert urging immediate opening of humanitarian corridors. Lebanon MERS case confirmed. The Lebanese Ministry of Public Health confirmed the country's first case of MERS-CoV on May 11 in a patient who had recently traveled from Riyadh. WHO is conducting contact tracing, and so far, 14 individuals are under observation. Hospitals in Beirut have been instructed to activate respiratory isolation protocols and prepare for potential regional transmission. Wellness and health promotion had a number of events. Oman Maternal Health Awareness Week. From May 8 to May 13, Oman's Ministry of Health ran a national campaign on maternal nutrition and safe birth practices in 9 governorates. Health workers and midwives offered community seminars, home visits, and free clinic days. The campaign also distributed locally developed mobile apps to support maternal health tracking. UAE Tobacco-Free Ramadan Final Push. UAE's National Anti-Tobacco Committee closed out its Ramadan 2025 initiative with over 80,000 individuals receiving cessation counseling. The ministry announced that cessation rates have increased 11% compared to Ramadan 2024, aided by AI-powered chat support and nicotine replacement delivered through community clinics. What happened in digital health innovation this week? Saudi Arabia, Sayha Virtual Hospital expands. Sayha Virtual Hospital, the kingdom's flagship telehealth platform, introduced 3 new AI-supported services on May 11, diabetic foot ulcer triage, remote mental health screening, and pediatric neurology second opinions. The expansion reflects Saudi Arabia's drive to position itself as the regional leader in AI-driven care at scale. Qatar Health App Integration. Hamad Medical Corporation integrated its hospital EHR system with Qatar's official health app, MyHealth, allowing patients to view diagnostics, prescriptions, and care plans. The rollout began May 13 and is expected to reach over 1 million residents by the end of June. Next we will discuss hospital updates. UAE Cleveland Clinic Abu Dhabi expansion. On May 9, Cleveland Clinic Abu Dhabi announced it will expand its oncology and transplant units, adding 200 beds and upgrading precision oncology capabilities through genomic profiling tools. The upgrade is backed by Mubadala Health and supports UAE's ambition to become a regional destination for high-complexity care. Kuwait University Hospital commissioned. The Kuwaiti government finalized commissioning of a new university-affiliated medical center in Sabah Health Zone. The hospital, which includes a research and teaching wing, will begin phased clinical operations starting July 2025, with an eventual capacity of 600 beds. Finally, let's talk about population health management. Bahrain National Diabetes Registry expansion. On May 12, Bahrain's Ministry of Health began full-scale implementation of its National Diabetes Registry, linking it with insurance and pharmacy systems to monitor glycemic control, compliance, and complications. This data-driven approach is part of a broader NCD control program and targets a 15% reduction in diabetic complications by 2030. Egypt Urban Hypertension Study launched. Egypt's public health agency began a population-based hypertension study in Cairo and Giza, enrolling 10,000 adults between May and July 2025. The project aims to identify structural risk factors and assess the effectiveness of existing community-based screening programs. Results will inform a new policy framework for urban chronic disease control. Let's conclude with this week's summary. Between May 8 and May 14, 2025, Middle Eastern healthcare systems advanced their goals of tech-enabled care, local innovation, and population-focused reform, even as humanitarian emergencies tested the limits of infrastructure. From Saudi Arabia's expanding virtual hospital to Qatar's genomic research investments, the Gulf states continue to shape the region's innovation frontier. Meanwhile, public health systems in Gaza and Lebanon faced severe operational breakdowns, underlining a widening infrastructure gap between stable and fragile states. Governments across the region leaned into data governance, biotech partnerships, digital integration, and community health campaigns, pointing to a maturing but still fragmented ecosystem. The coming weeks will test whether these strategies can scale effectively, and whether urgent crises can be met with equally rapid and coordinated responses. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.